Okay, I see a bunch of people have joined in. We're just introducing ourselves in the chat, or feel free to unmute yourselves and do that. But we have hit the 12:30 mark. So I'm gonna start by saying that my name is Sushi. I am a communications coordinator here at SARAVYC, and I'm really excited to be here today. And it's my pleasure to introduce Yashvi, who is going to lead the session today. Yashvi holds a Bachelor's of Sciences in Integrated Science with a focus on global health and physiology from UBC. With a deep rooted passion for community health and research, her professional journey spans diverse experiences in clinical research, project management, and community engagement within the healthcare sector, which makes her a perfect candidate to talk about what we're going to talk about today. So, without further ado, I'd like to pass the mic to Yashvi. And Yashvi, please take it from here.
Thank you, Sushi. That's so kind of you. For everyone that's here so far, Sushi did a great job of introducing myself. I'll repeat that. My name is Yeshvi. I use she, her pronouns. Privileged to work with SARAVYC in this space. I've been with SARAVYC for about 3 years now, and I've seen some amazing projects, and this is just one of the projects that I get to present today. So I hope to share a little bit more about CERAVIC and the work that we do, and hope to have you continue on as we bring more of our work into the community for folks like yourselves in different spaces to help us bring it to youth and parents and different adults who may work with youth as well. So I think with this, can everyone see just the title of the screen?
Yes.
And perfect. And then I'm going to move to the next one. You should see the land acknowledgement screen.
Mm-hmm.
Okay, perfect. Everything's working fine. So I do hope everyone has lunch or something that you're snacking on. Feel free to take this as a podcast. I was telling a friend of mine about the work that I was doing, and then they were like, "Oh yeah, I'll listen in. It's like a podcast." And I was like, "Okay, I guess so." I've got chai for myself, so I'll be sipping on that. And it gives me great honor and privilege to be able to say that the work that we do with stigma and resilience among vulnerable youth center. SARAVYC is situated on the unceded and traditional territories of the Coast Salish peoples, including the territories of the Musqueam, Squamish, Tsleil-Waututh nations. There's a lot of work that has been done in the past, and a lot of the work that we're doing now to help make resources, make opportunities more equitable in the work that we do. For the purpose of today's session, I won't be able to see too much of the chat and the I can't see anyone who's got video on, only because I'm only seeing the presentation. So I will have Sushi kind of nudge me if there is anything in the chat or anyone who wants to unmute and share anything. With that, I would love to share with you what I will be going over today, a little bit of a welcome and introduction about CERAVIC and the work that we do, a project overview of the specific project that I'll be sharing today. And then with that project, we've been putting out workshops in the community. So some feedback from those workshops. Also, kind of going into where do we go from here, how to get involved. And we've saved some time for discussion because I would really, really love to hear about the communities that we serve. So I'll move forward. Hello, everybody. And I think for folks that joined a little early, people were introducing themselves in the chat. So if you feel comfortable, feel free to drop your name, your pronouns, where you're coming from, your role, if that is relevant. Feel free to share that in the chat. It's really nice to see where our work reaches. Honestly, I think the work that we've been doing, it reminds me that it does take a village. The work that we're doing for our youth and for families, it takes a village. And so I really appreciate you all for being here and sharing what you will. All right. So a little bit about myself, as you already heard, Yashvi and pronouns she, her. I'm privileged to be the coordinator here with CERAVIC. been here for 3 years, as I mentioned, and I've seen a variety of wonderful projects. SARAVYC itself stands for Stigma and Resilience Among Vulnerable Youth Center. And SARAVYC is an international, multidisciplinary, award-winning research center since 2006. The center has studied how stigma, discrimination, violence, and trauma affect young people's health, and we help develop and evaluate interventions to foster resilience and health equity. Youth that are targeted by violence and discrimination experience health challenges, and we focus on identifying protective factors to buffer the stigma to improve health outcomes for youth throughout Canada and internationally. Our main population of focus is 2S LGBTQ plus young people across diverse cultures. By collaborating with youth and their communities, SARAVYC develops culturally and contextually relevant interventions that not only improve health outcomes and equity for youth, but also influence policies and practices worldwide. Over these 2 decades, we have collaborated with diverse youth policymakers, educators, health and service providers, and caregivers to produce health and equity evidence that has improved practice and been integrated into education, including SOGI 123, a sexual orientation and gender identity education resource in Alberta and BC, and in BC's Options for Sexual Health, sex education for youth and adults. Now, as I mentioned data, I'll move forward on the next slide. So as I mentioned data, in BC, we rely heavily on the BC Adolescent Health Survey, short form BCAHS. It's conducted through the Mercury Center Society, and it happens every 5 years for youth in high school, so grades 8 to 12. And we now have access to over 30 years of data. So with this project, in a review of that BC Adolescent Health Survey, we found that 2S LGBTQ plus youth reported significant dissatisfaction with school sexual health education. Fewer than half of queer and trans youth felt that the sex education they received was not helpful. Now, sexual health education plays an important role in improving health and overall well-being. Providing youth with accurate education is crucial for healthy development. This is particularly important for youth who already face significant health disparities. And now, even when sexual health education is provided, it fails to address the needs of a more inclusive sexual health education that can better meet the needs of these young people in a safe environment, especially if they are not yet out. Now, to address these gaps, we propose the development and implementation of this project, an inclusive sexual health education program to be offered at universities, schools, and in the community. This project is called For Youth Like Me, and it's been funded by Health Canada. So now, as you can see on the screen, I shared a little bit about how we're working with youth. The second part of this project is for parents and caregivers and guardians. From a lot of the work that we do in the community and all the different projects, we've seen that parents and caregivers of migrant, newcomer, and refugee youth also may not have had adequate sexual health education during their school and often have misinformation about sexual orientation, gender identity, and general sexual health. So we involved parents and caregivers in this program through education sessions because supportive and well-informed adults can help youth make the right decisions and provide the support that they need. Now, since we have limited time for today's presentation, I will focus on the part of the project that works for parents, caregivers, and guardians of migrant, newcomer, racialized, and refugee youth. All right. So as this project began, we began the conversation with parents, caregivers, and guardians in the summer of 2025. We kept our advisory sessions open format and asked some questions just to guide the conversation. As you may see on the screen, and for those that are listening in, I'll verbalize, of course, but we asked parents, caregivers, and guardians, did you receive sex ed? That was the first question that we opened the conversation with. And some responses were, no, it's a big no in our culture. Another respondent said, it was a scary time when I got my period for the first time, didn't go to mom or dad, went to my big sister, and the sister shamed me. Another individual said, can't directly talk to mom or parents due to the cultural divide. Now, just a reminder, these are parents and caregivers and guardians that joined our in-person and online advisory sessions in the summer of 2025. So a little less than a year ago. And then lastly, one of the respondents said, on my wedding day, I had a cousin who finally told me more details. Now, with the structure of today's presentation, I would love to invite conversation and discussion at the end, but if there's any questions or anything you'd like to add in the chat, feel free to do so. I'm going to continue on and share a little bit more. So the next question that we asked in these advisories were to parents, caregivers, and guardians again, were what topics should we cover in this workshop? A couple of the respondents agreed on some topics, and the discussion was with healthy relationships and consent. That was a topic that was identified. Some of the parents in our advisory session said, how to say yes to things we want. How do I know what I want and ask without feeling ashamed? That was a lovely response from an individual. Another parent in one of our sessions said sexual health was an important topic. They said that parents are unaware of what this, and in that conversation, they were referring to the HPV vaccine and other sexual health, um, I guess, interventions and things that are available in healthcare. So they said parents are unaware of this and specifically about the HPV vaccine. And they said what this is for and also how important it is for future. Another topic that was identified was rights and the law. A parent said age of consent and sex and what they need consent for regards to medical care. They, in this conversation, was what are their youth eligible for? What can their youth access as well? And so that was some of the conversation that we had during these advisories. And from these advisories, we identified from a long list of nearly 15 to 20 topics, about a 2-hour advisory session that we had 3 times. We came up with 5 topics. So the 5 topics that were finalized were consent, gender and sexuality, rights and protections, sex and the law, and healthy relationships. Just a little personal tidbit. As an immigrant myself, I feel like these topics, these conversations, they don't naturally happen. And coming to these topics was really beautiful to be in that advisory room, to be able to share this deep information with you, to have parents and caregivers that were vulnerable with us and shared with us what they don't know. And personally, I found healthy relationships mentioned to be just so wholesome and very valuable. If I can quote one of the parents, they had said, we have not seen healthy relationships ourselves, and we don't know how to model it for our children. And I think that was just very lovely for someone to say. And so that's a bit about the project, where it came from, how we put things together, and what topics we finalized. And now I'm going to go into a little bit. So since summer of 2025, we've gone through quite a few hoops, quite a few spaces, and I'm pleased to say that we've had workshops all around the Lower Mainland. And we are hoping and we are working really hard to bring these all across Canada. So if I can share a little bit more, the workshops that we've had so far, we've had 48 parents and counting since this was reported. And we've hosted sessions in partnership with community spaces like Options Community Services. With them, we hosted a session in Punjabi, in Farsi, and in Spanish. And then we had the South Asian Collective Society, which is based out of Port Coquitlam, a lovely group. And we put together a session mainly in English, but they were South Asian parents that did join. We had another session in person with the Gujarati Society of BC, and we had the session in Gujarati. Another session that we had was with Thrive Community Services Society, and a lovely community, very new to the community services space, but they serve the Farsi community, and we had a session in Farsi with them. Latin Couver is also an organization that supported us. We actually, sorry guys, we actually had a mom, just a parent that I met through Latin Couver, who was very, very, very interested in this topic and this project and the workshops. And so what we did was we worked to identify different folks in the community, but then took the umbrella of Latin Couver. We asked Latin Couver for some support to be able to disseminate this in the further Latin parent community. And then lastly, the Hindu Mahila Society. So this community, we actually got to go out and speak at their Women's Day event. It's a society that's dedicated to Mahila, which means women, Hindu, which is a specific religion. And so folks that were women that were in the society were really, really interested in this session. And we hosted a session online and we hosted in Hindi. So this is a variety of workshops that we've had so far. And again, we're hoping to grow. We're hoping to have these in multiple spaces. These languages are the ones that we've shared so far. And when I say we had these in languages, through Health Canada, we have the funding to provide interpretation services during sessions. So whether it's online or in person, we have an individual either from the community or from our own team or from the organization helping us translate almost word for word or sentence for sentence as our educator is speaking. And the educators that we have in these sessions are from our certified sexual health education educators from Options for Sexual Health here in BC. And across Canada, we're working with sexual health education, certified sexual health educators through Planned Parenthood. And again, in BC, they're called Options for Sexual Health, just a little caveat in the name. Now, can't wait to share with you the feedback that we've gotten so far. So with the parent workshops, we had a 2-hour session, either it was online or in person. And then we had a survey, which was also in multiple languages. We were able to put the survey out after the session, and this was entirely optional for folks that wanted to participate. We were able to offer an honorarium. The session and the workshop itself is free. And then with this survey, we were able to offer an honorarium. I'm going to take some time to read out loud this feedback because as I was putting this together, it was just so nice and wonderful to see the work that we've been doing. So for folks that are listening in, the feedback that we've received, so some parents said they wanted to have more of these workshops. They felt like 2 hours was not enough and just one wasn't enough. Um, Someone suggested content was good, but maybe advertising material could be changed so the community understands a little bit more of what this is about. And now this was really important because realizing that language transcends so many different things and some words mean different things in different languages. And so working together with the community to really be able to bring this into the community, not so that the community has to come out all the way to reach us. So that's been a big part of how we've been addressing a lot of the feedback. Now, I wanted to start with the feedback that was more about improving the program. So a little bit more was they asked, try to take questions from participants in writing form, as some participants might not feel comfortable openly asking questions due to their values. And we're taking this into consideration. We're really hoping to work with the educators to provide an anonymous question space or something that folks can ask. Now, another parent said, for me, it was perfect. Maybe an application that generated it being translation, it in real time would improve the translation time now that there are platforms that translate in real time. We really wanted to have these sessions as a space for dialogue and conversation. So having someone from the community translate or someone from our team translate has been really valuable, and we've really enjoyed the conversations that people can have with a real person and not just a software or something. So I think that was something that I thought to share. And there's some more that folks can read that are on the screen. With regards to time, I'm going to go to the next slide, and I can always come back when we're discussing. So some wonderful feedback that we've also gotten in various languages is parents said that this was insightful, engaging, and a comfortable space for conversation. Parents also said that it was quite informative and backed by data, which is something that we really appreciate folks for saying. Now, another parent said the quality of information with data, scientific resources, and statistics belongs to Canada was a good thing. In Spanish, one of the parents said, and I'm not going to attempt the Spanish, but they said it helped me change my mindset a little. Um, so yeah, if I can continue on, one other parent said the speaker created a comfortable and non-judgmental environment to discuss sensitive issues, and the presenter provided the information in a friendly manner. And just lastly, if I can say, another Spanish respondent said, I learned new terms that I didn't know or that weren't used in my teenage years. So I'm thankful for this space right now to be able to share this feedback that we received from parents, feedback that helps us improve this work, and feedback that helps remind us that the work that we're doing is good and it is meeting the needs of the community. All right. And I know we're kind of with time, so I'm just going to go into the end of this presentation. So I wanted to take some space to talk about what we have coming up. So we've had a bunch of sessions since December, and coming up we have a couple more sessions. So we've got a session in Spanish coming up on May 13th. We have the Delta Local Immigration Partnership that's interested in working with us. We're doing an online session with them on May 21st. TBD is written there because we haven't identified what language. And I wanted to bring this up because with the community and with the posters and the things that we're putting out there, we want to be able to address what the community wants. So if there's a specific language that is of interest, then we want to dedicate that session for that language. And so just keeping it very open to folks that are signing up and expressing to us what they need and want. And then continuing on, we have the South Asian Health Institute from Fraser Health that is interested in putting out a session. And we're hoping to put together something in person over the coming months. And very lastly, I've got Shri Spices, which, and this is where maybe our discussion and conversation can go a little bit more, where we got a little bit creative with where community is. And kind of meeting the community where they're at. So Shri Spices is a Sri Lankan commissary restaurant, I would say. They operate a couple days a week, and it's a very specific cuisine. It's very underrepresented, and I had the privilege of going myself a couple months ago and meeting with the folks that run this, and the people that run it were parents themselves, and it was just so wonderful talking to them that we are working to put together an in-person session with good food, with good Sri Lankan food in Sinhala, and this will be in New West, and then I've got and many more. So with the folks that are here today, with the spaces that you can imagine this being in, I really want to invite that conversation. And as I go into the last little bit, where do we kind of go from here? So for our parent sessions, we are hoping to connect with some parent advisory groups, and then more community organizations, and then spaces. So restaurants, businesses, spaces where community exists, and we can bring this workshop in a very culturally sensitive, culturally relevant space. And so with that, I would like to end my part of today. Thank you again so much for listening to what I had to share about the project. Just because our session today was only 20 minutes, I'd love the opportunity to discuss more. We can set up meetings and chat anytime. I really hope you got an understanding of what SARAVYC is and what we do. I'd encourage you to check out our website. And now I think I will exit this. I will stop presenting and open up the floor for any discussion, thoughts.
Thank you so much, Yashvi. I know that people have already introduced themselves in the chat, and I see a lot of people from the community here. So, without taking too much of anyone's time, I want to open it up right away. If anyone has any questions, feel free to unmute yourself and ask, or just drop anything in the chat, and I can read it out to Yashvi and everyone else.
Yes, so I'm looking forward to volunteering at the Foundry, which is a primary care center for youth. And just from my own personal experience, I volunteer for youth in mental health and addiction. So, especially the caregivers, like their parents that are struggling with their loved ones. So, this is very educational for me, and that's why I'm joining you. Thank you.
Thank you, Ranjit, for sharing that. Because I know Foundry works in a lot of different ways and spaces. I think Monica, the managing director, by the way, at SARAVYC, has dropped my email into the chat. So if I can continue this conversation in the various spaces, I would love to. Thank you again, Ranjit, for sharing that.
Thank you. Thank you.
I don't
I
have
have a
one.
question. When I was listening, maybe you said it, but I didn't capture it. When you are translating during the education, is that really indeed translating happening? So you're giving English and then you wait a beat and then you have the other language come in, or how can you just let me know a little? Because we're doing very similar work, but for user engagement focus groups, and we're going to be having English and then translating to other languages. So I'm just curious how that worked practically and how you're feeling about it all after.
Yeah. Yeah. So most of our sessions, we've identified one language, and then we do have one individual who's seated right beside our educator. We've got those 5 topics that are identified, and I do take some time with the translator or interpreter just prior to the session to review the main ideas. So it's not like it's so completely new to them. And then during the session, we have our educator speak a couple lines, and then honestly, it's between the educator and the interpreter. They lock eyes. They're like, okay, pause now because I want to talk, like I think, so it's been a bit of like capturing main ideas. It's been a bit of even from the audience, just pausing and being like, I didn't understand what they said there. Can we pause here? It's been a lot of just tailoring it to the community that shows up. I think that's been key. So that's the way that we've worked with our interpreters so far. And if I can say plain and simple, it is like the educator will speak a couple lines and then the interpreter will speak. That's what we've decided. And then, of course, we tailor it as per the different sessions.
Thank you.
And lovely to have you here, Jenny. Thank you.
Well, I would just say we're grappling with the idea that we actually want to have parents present in small groups that will have various language needs.
Mm-hmm.
And so we were wondering if we're going to send people out to breakout rooms after hearing the English version. And of course, our facilitators actually are experts in the content, so not translating, but also like creating content with us and then delivering it. So it's just nice to hear what you've experienced, and it helps things bounce around in my head productively, probably. So thanks.
It's all, yeah, trial and error. Our very first session, we didn't have any input from the organization. And so we had, when we asked, just in person if anyone had any support that they needed, all of a sudden we had 3 languages. And so that session went on a little longer than it should have. But it was just, again, we had Punjabi, Farsi, and Spanish at the same time. So our educator would talk, and then there'd be 3 different conversations happening. So that was our very, very first session. And since then, we've been like, okay, let's definitely just focus on one language at a time. But that was still really valuable, just seeing that different communities could come together and also have shared conversation.
Wow. Okay, I'm going to reach out to you and chat about that offline. Yeah, thank you.
To add, even in our feedback Qualtrics, there were like 3, 4 different languages in the open text box, and we were trying to kind of translate it. So folks are using and expressing any questions they have in their own native language, which is so great to see. So yeah, just wanted to add that in.
Thank you. I think someone had a hand up.
I think there's also a question in the chat, and then Shams had her hand up. So I'll read out the question in the chat first. Thank you, Yashvi, for the great updates. For presentation outside BC, does the data used in the presentation reflect the provinces or territories data? And this is by Anya.
Yeah. So with this, so far our presentation is based on the BC Adolescent Health Survey, and BC is where we are based. But as we are trying to take this nationally, our main collaborator is Planned Parenthood in Newfoundland. And I think I'll pause here because I have some wonderful people from our bigger team that can help address this question.
So I can answer that. We actually have national data from the health behavior of school-aged children that has sexual health analyses, that we did that database analyses of migrant youth who are this age, and are, have incorporated that for when the next, presentations beyond BC happen. Unfortunately, a lot of the provinces don't do a specific province survey that asks about sexual health in the way that BC does. There's a couple that do, but most of them are part of the health behavior of school-age children. And so we're basically reporting the national data rather than at a specific provincial level, only because Saskatchewan doesn't ask questions like that. Alberta doesn't. I don't think Ontario does either. But so, yeah. But we do actually say, well, at least we've got the national data that actually includes people from all the provinces and territories. And the data really aren't that different. So we're hoping that that just provides reassurance to people that, yes, our teenagers are all experiencing the same kinds of things in our communities across Canada.
Thank you, Elizabeth. I hope that helped answer. Feel free to unmute if there's any follow-up.
Shams.
Thank you, Yeshvi. Are you able to hear me?
Yes.
Okay, great. So I'm wondering if you are open to the idea to include other languages within this form of education. I know you have mentioned so far 5 languages. So let's say a community partner have reached out to you and let's say they are interested in Arabic format. So are you open to that? Because I feel this is so important. And also, are you open to make sessions like women's only sessions? And why I'm saying that, I'm coming from a culture where some topics women they prefer to have like a women only session, or you can do women only or dads only, because this adds like another element of support at home. I hope it makes sense, Yeshvi.
Oh, it does.
Yeah,
And
yeah,
I'm
thank you.
actually really, really glad that you asked that. And this is where I went into the different, like kind of creatively looked at spaces other than just community organizations and looked at community spaces. So one really wonderful space was like restaurant spaces. And I think bringing people together over food is just such a shared culture space. And there is actually a cafe in downtown Vancouver. The owner themselves speaks Turkish and Arabic. They have folks coming in that speak Korean, Japanese. They have like a regular weekly chess club that they were mentioning. And so, again, just accessing all these different spaces, knowing what the community needs, and knowing that there are interpreters available in the community to be able to help us bring folks together and have that session. I can tell you it is there. I'm working with them to hopefully host that session in downtown Vancouver. Cute little cafe, wonderful food, and I think it'd just be valuable. And then, as you mentioned, women only or men only, or however that works, that is very relevant. I did have the opportunity of doing just a mom-only event. As I said, the Hindu Mahila Society, which is based in Surrey. Mahila means women or female. And so that was a session that was specifically only for parents that identified as a mom from that community. And it even went a little further, just keeping it exclusive just for the folks that are in that organization. So I want to say with each of these sessions, one big word, and I think I should have mentioned it during my presentation, is we employ a closed recruitment. And so that is where we're not actively advertising these opportunities or these workshops. We are hoping to work with partners in the community to be able to create that safe space, because I think that is very, very key. And I think you mentioned that. And so a big part of me going into the community and talking about the work that we're doing is to remind people again that this is the work that we're doing is tailoring it to the community that wants it, right? I hope that's key, and giving people as much as they want out of this, right? So I have been trying to connect in different spaces. As I mentioned, there's that one cafe, but I'd love the opportunity for other spaces. So for folks here, if there are other spaces, if you yourself are fluent in any languages that you would like to bring to your community or spaces, please do reach out. And I see in the chat, yes, I would love to come out to Foundry. So, Chris, I'll send you an email. or actually, I'll drop my email down here if you can shoot me one. Or if you want to DM, send me or
I
message.
can send you an email and we'll set something up.
Perfect.
Thank you.
Perfect.
Wonderful conversation today.
Oh, thank you so much. I'm glad. Yeah, I guess we're kind of at time, and thanks for staying a little longer. If there's any questions, any thoughts, drop my email in the chat. Please do reach out. I hope you do get to spread this far and wide. And for work at SARAVYC, these lunch with SARAVYC sessions are recorded and they will be available on our YouTube. And so we're really hoping to keep this going. And next month, I believe, I'm not sure what date, but it's a Thursday, probably the end of the month, where we're gonna have our next session in another topic and another project that's happening at SARAVYC. So please stick around. There's a lot of good work.
Thank you, Yashvi. This is a monthly thing, as Yashvi mentioned, and everybody present here today will get an email from me about how to access the other sessions. But if you found us online, you know that we do advertise our sessions online. So I'm hoping to see a few of you, if not all of you, at the next session as well. Thank you, Yashvi, for the amazing conversations. We can keep the conversations going if anybody likes, or we can continue over email. Yashvi's already dropped hers in the chat. So, yeah.
Yeah, I'm still here. Yes.
Okay.
Thank you. Enjoy your lunch. I hope you enjoyed it. I had chai this time with me.
Thank you, Yashvi.
Oh,
Thank
thank
you, Yashvi.
you. Thank you.